And welcome. Federal government threatens to sanction private hospitals treating COVID-19 cases without accreditation. 5 more patients, 2 males and 3 females, discharged from isolation centers in Lagos after recovering from COVID-19, even as states record 3 new deaths. We examine the impact of the 14 days extension of the lockdown order in Lagos State on some Lagos residents living below the poverty line. And UK Foreign Secretary Dominic Raab announces that the country's lockdown will continue for at least 3 more weeks. Plus, business, sports, news from Abuja, the FCT, and later from our studios in London.
On Business News tonight, OPEC cuts 2020 oil demand forecast further as coronavirus outbreak pushes global demand to a 30-year low.
Sports news tonight, former Super Eagles midfielder Dixon Etu banned from all football activities in Sweden for 5 years.
And from Abuja, Speaker, House of Representatives meets with leadership of NNPC and electricity distribution companies to negotiate modalities for free power supply for Nigerians during the lockdown period.
With a spike in the number of COVID-19 cases in the country, and Kano State alone recording 12 cases today, the federal government has warned that unaccredited private hospitals engaged in the treatment of patients will now risk closure for an indefinite period. The Minister of Health, Dr. Osage Henire, made this clear while giving an update on the status of the pandemic at the Presidential Task Force briefing today in the nation's capital, Abuja.
Our valuable health workers are urged to adhere to all government instructions and regulations, to always utilize personal protective equipment as the situation demands, to maintain a high index of suspicion for COVID-19 infection, and to protect themselves, their loved ones, and their colleagues. I use this opportunity to again strongly advise my colleagues in medical profession against secretly or privately managing people who have COVID-19 infection outside of accredited health facilities. We cannot afford to have avoidable morbidity and mortality. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease. Practitioners engaging in unauthorized treatment of COVID-19 run the risk of being shut down, their hospitals being shut down for decontamination.
It was not only the Minister of Health that spoke at the Presidential Task Force briefing today. Other members of the task force also appealed to Nigerians to change their attitude towards survivors of COVID-19.
The remarks by the Secretary to Government, SGFSO.
The chairman of the Presidential Task Force on COVID-19 begins his remarks with an appeal to the public and law enforcement agents to show some level of restraint during the lockdown, just as he advises the states against hurrying to relax the order.
The PTF continues to count on the collective cooperation of all Nigerians in our effort to contain the spread of this deadly virus. I think it's becoming very obvious now that we need to be stricter, and this appeal is going to the subnational entities, that this is not the time to relax the lockdown in those states.
Contact tracing, isolation, testing and treatment are some of the global best practices to curtail the spread of COVID-19. Although the approaches are judged to be very effective, the Presidential Task Force says discrimination against persons in isolation can negatively affect government's efforts to trace contacts, isolate, and test people for COVID-19.
If we start stigmatizing people because of an infection, It will not only disrupt all the great work being done across the country, but it will have a profound impact on our ability to control this outbreak and our ability to get back to life. So as we roll out testing, as we increase our testing, with all the pressure we've had to do so, it will be counterproductive if at the same time we stigmatize those that we're now finding to be infected.
Lagos, Abuja, and Ogun states are among several other states and cities in Nigeria currently enforcing a lockdown in order to enable contact tracing, isolation, and treatment with a view to flattening the curve of COVID-19.
Five more COVID-19 patients have been discharged by the Lagos State government from the mainland infectious diseases hospital. Governor Babajide Sanwo-Olu, who announced this on his verified Twitter handle today, says the discharged patients are 3 females and 2 males, having recovered fully and tested negative twice to COVID-19. According to the governor, this brings to 90 the number of patients successfully managed and discharged from the isolation facilities in Lagos. The state has, however, recorded 3 more deaths from COVID-19 related complications, including a medical doctor who had contact with an infected person that recently returned to the country. This was announced by the Commissioner for Health, Professor Akin Abayomi, who said that the dead are all male, aged 51, 52, and 62. Now, beyond the doctor, the other victims have no travel history or record of contact with any infected person. Kano State says it has recorded its first COVID-19 death and an additional 12 cases of the disease, bringing the total number of confirmed cases in the state to 21. This was confirmed by the Kano State Ministry of Health. All 21 cases were discovered in less than a week, with the index case reported last Saturday. The state is already on lockdown for a week, with markets, mosques and churches to remain closed. Our correspondent, Idris Jibrin, has this report.
Kano, Nigeria's second largest industrial city, and by extension, one of the most populated states in the country, has now joined other states observing the lockdown. The reason for this is due to the increasing number of confirmed cases of COVID-19 pandemic, which at the last count stands at 21, according to the State Ministry of Health.
There is no doubt it's a serious issue which all serious people must pay attention to. In Kano State, we have taken this issue very, very seriously, and we have taken enough measures to see that we curtail the spread of this disease into Kano State.
Before the lockdown was imposed on Kano State, the government had declared a stay-at-home order for civil servants, banned movement of vehicles except those on essential services, and also closed its borders to prevent people from coming into the states. It is no longer news that the state government has taken some proactive steps, like the setting up of a task force on COVID-19, as well as isolation centers to prevent the spread of the virus. Despite these efforts, the numbers keep growing almost on a daily basis since the index case was announced.
The 33 number of people screened for the virus across 4 states of the country, which include Lagos, Ogun, Edo, and Kano, and also FCT, 3 of the samples of the 25 people that tested negative to the virus were from Kano State.
On its part, the task force on COVID-19 says more contacts are still being traced, with about 90 samples sent to the Aminu Kano Teaching Hospital. Meanwhile, the state has recorded the first death associated with COVID-19, and this has prompted Governor Ganduje to appeal to residents to stay at home and observe all necessary personal hygiene. Idris Jibrin, Channels Television News.
Governor Abubakar Bello has raised concerns over the lack of a testing center for COVID-19 in Niger State after the NCDC confirmed a second case of COVID-19 in the state. He's asking the Nigeria Center for Disease Control to set up at least one quickly. The governor, who was on an inspection tour at one of the isolation centers in Minna, donated by a private individual, says he's worried that there could be more cases yet to be identified due to lack of a testing center.
We have 2 confirmed cases that we're aware of. There may be more. But because we have a problem, we do not have a test center, we really cannot confirm the number of cases we have. However, the 2 cases we have, from the information I have, the patients are stable, and hopefully very soon they will join their families. But my appeal to NCDC is to assist, to help us so that we have a test center here. Unfortunately, we cannot do much with regards to testing. I mean, we can take samples, and it has to go to Abuja, which is closest to us. Abuja is the closest test center. And sometimes when we send those samples, it takes 3 days, 4 days, 7 days sometimes. We're trying to work with NCDC to see if we can convert 1 out of 12 of our laboratories into a test center.
From Niger, we head to Kaduna State, where the government has stepped up plans to transform the National Youth Service Corps Orientation Camp, located along the Abuja-Kaduna Highway, into an isolation center for incoming travelers. The State Deputy Governor, Hadiza Balarabe, who inspected the facility along with members of the COVID-19 task force, warns unauthorized persons coming into Kaduna State during the lockdown to turn back or be ready to be isolated at the NYSC camp for 14 days.
If you don't want to stay in your place, when you come, you have to stay there for 14 days. We observe you until we're sure of your status. Then we can either let you come in or we send you back to where you're coming from. We don't want a situation where we lose on all the gains that we have recorded so far, from all that we have done. So these are just measures, that the government is taking to ensure that Kaduna people are safe. I think 17 entry points, and we'll all have this kind of thing around those areas, because we want to keep our people safe. It's not only Kaduna City that we're concerned about, we are concerned with the whole of Kaduna State. It's our responsibility to make sure that we keep our people safe, and whatever it is that we think we need to do, we will do it. We're talking about it, and I think that, at least as you can see today, the number of vehicles that we found on the way have actually reduced. So I think we'll continually talk about it, and if you have any evidence, please bring it to us and we'll take it up with the agencies as may be necessary.
In Anambra State, southeast Nigeria, the police is investigating a viral video showing a police officer who allegedly shot a person and deflated the front tires of a car while enforcing the lockdown order in Orumba South local government area of the state. The Commissioner of Police, Mr. John Abang, describes the incident as sad, but gives assurances that justice will be done in the case and the outcome will be made public.
Looks like damaged police outfit, an AK-47 rifle, and on another hand, a corpse of a young man in New Tire axis of Nkwo in Idemili North Local Government area. These are the evidence in the event of April 15th, which caused unrest in some parts of Anambra State.
We are going to go after them, don't worry.
The incident that led to the unfortunate occurrence is immersed in controversy as the residents blame it on the police patrol team, which was in the area to enforce the lockdown order.
The guy they killed in question he's not even walking on the road. He's walking on his street, and they killed him. There are 2. But thank God, one is in the hospital now. But the other guy, look at him there.
But the officers involved have presented the damaged cloth alleged to belong to the attacked officer Christopher Ozo, an AK-47 rifle, as evidence of what they call unprovoked attack against them by the youths.
Invited him to come over to
the Commissioner of Police in the state, John Abang, had initiated investigations into the matter, and he discloses the initial finding.
After listening to the whole report, I directed my DCCID to immediately commence an investigation, and if need be, the officer will be queried.
Reinforcements from the police mobile force, SARS and special anti-cult unit have since been deployed to the area to restore normalcy.